story today comes from a UK publication, Life Science News by Emily Cook. Could cannabis treat cancer someday? Here's what the science says so far. For decades, cannabis has been studied for its potential anti-tumor properties, but whether it can actually treat cancer is unknown. It may sound far-fetched that weed, the high-inducing plant that would cause reefer madness, could contain ingredients that shrink tumors. However, scientists have told Live Science News that there's some evidence that cannabinoids, the active ingredients found in cannabis, do have anti-cancer properties. There's no doubt about it. Cannabis has anti-cancer properties, says Wei Liu, senior research fellow at St. George's University of London. But the problem is, how do you translate that into the clinic? And that's a difficult question to address. Research studying whether cannabinoids directly shrink tumors is in its early days. At this point, it's been mainly limited to preclinical studies on human or mouse cells in lab dishes or in animals. Synthetic and plant-made cannabinoids have been shown to impede the growth of breast cancer, colorectal cancer, prostate cancer, and skin cancer. In animals, the cannabinoids were directly injected into the area around a tumor. However, the news is not all positive. Under certain circumstances, THC has been shown to promote tumor growth. That was in lung cancer. These differences could partly be explained by studies using varying doses and investigating distinct types of cancers, meaning THC could work for one type of cancer, but not another. There's a big difference between what you observe in a cell line in a petri dish compared to what will happen if you treat a human who has that cancer, says Dr. Michael Sodergren, head of the Medical Cannabis Research Group at Imperial College London. There have been only a few small clinical trials, and all have focused on just one type of cancer, glioblastoma, the most aggressive form of brain cancer. In 2006, scientists showed that THC injections directly into the tumor of brain cancer could safely and effectively inhibit their growth. The trial included just 9 patients with glioblastoma. In 2021, a separate research group published the results of a trial that included 27 people. One group of participants used a mouth spray containing a mixture of CBD and THC in combination with a traditional chemotherapy drug called temozolomide. Twice as many patients who received the cannabinoid spray were alive after 1 year compared to the group who received a traditional drug. It's possible that the cannabinoid spray helps push the tumor cells towards cell death, said Dr. Susan Short, a professor of oncology who led the research at the University of Leeds in the UK. Despite the progress, many questions remain about how cannabinoids might fight cancer at the molecular level. And do terpenes or other constituents in the cannabis plant contribute to the anti-cancer effect? According to Dr. Brooke Worster, an assistant professor of medicine at Thomas Jefferson University in Pennsylvania, the positive results are certainly worth investigating. In the meantime, patients should take the results of these studies with a grain of salt and not avoid taking treatments that are known to be effective. So do you know anyone who has recovered from cancer using cannabis? This is Dr. Jean Talleyrand with High at 9 News.
I feel like this is good news, right, Dr. T?
It's old news, really. Research is slow, but we've had these studies happening. They pointed out the glioblastoma study in 2006. You would think they'd move it along a little faster, but it's good that it's progressing.
I do find it interesting, too, of how they're distinctifying, because there are many different types of cancer, and they're saying that cannabis is good for some cancers, but not all cancers. And I think that's really important for people to know overall, because oftentimes cancer is just looked upon as one blanket kind of type of illness, even though it affects many different parts of the body and attacks the body in different types of ways. And And so I think that is good for people to know that cannabis is not good for all cancers. I think that's something really important, because I think a lot of the times the activists get caught up in the thing of like, yeah, cannabis is great for cancer, da 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 da, and they're always beating that drum. But from what you're saying, that there's some types of cancer that it's not actually good for.
That's right. There was a type of lung cancer that THC, and this was just in a petri dish, the lab dish. So it might be different in a live person, but some type of lung cancer that cannabis seemed to promote the growth. That THC seemed to promote the growth, not the whole plant.
For the two doctors in the room. What is the percentage of from when you see something that works in a petri dish to actually works in real life on an actual human? What is the percentage or ratio that you think it translates?
You want to do that, Mark?
Yeah, it's very small, because in a petri dish you're just looking at a enzymatic assay, or you're looking at some cell culture, and the human body is much, much more complex. But that gives the scientists the lead. So often what they do in cancer laboratories is they'll identify a target, identify a protein target in the body, and they know if they get a compound that binds to that protein target, it could basically shut down that protein's role in the cancer disease at that state and time. But you got to remember that there's literally millions of different enzymes and proteins in your body that these molecules can interact with. And so what you're looking for in a petri dish are compounds that basically kill cancer. And we know that there are toxic compounds that kill cancer, but often those compounds which are administered during chemotherapy do so much more collateral damage to healthy tissue that often the patient succumbs from the toxicity of the chemotherapeutic agent itself. So do we know chemicals that will stop tumors? Yes. Do we know chemicals that will stop tumors, but also are safe to the rest of our body? I mean, that selectivity is basically what cancer researchers are looking for. Mm-hmm. But what Dr. Talleyrand and I already know is that on a molecular basis, there's actually a rationale on why cannabinoids like THC and CBD elicit their anti-tumor properties. They're antioxidants, and what antioxidants often do is they quench things called free radicals. Mm-hmm. Free radicals are in the body that can often damage DNA or other cellular components. So the antioxidant effect of cannabinoids often will protect you from cancer. That's why the U.S. government had this patent on neuroprotection of cannabinoids. It's because basically they're potent antioxidants, and they're unlike things like vitamin C or ascorbate, which is water soluble. These antioxidants are fat soluble, so they deposit in the fatty tissues of your body, including organs like the pancreas and the brain. And so now you're basically fortifying those tissues with antioxidants that can basically intervene in cancer's progression. The other mechanisms by which cannabinoids elicit their anti-cancer activity is they're also anti-angiogenic. And so solid tumors have to thrive by recruiting vascular plumbing to feed it with a fresh blood supply. And that process is called angiogenesis. So what the tumor does is it emits these what are called vascular endothelial growth factors, which start sprouting blood vessels to the tumor. And when the tumor gets a fresh blood supply, the tumor will grow and thrive. Well, cannabinoids are known to be anti-angiogenic, so they basically keep tumors from growing by cutting off their blood supply. Another thing that I think Dr. Talleyrand pointed out is that they're pro-apoptotic. And what that means is that in the life cycle of the body, cells live and cells die. And when cells don't die, and they don't die a happy death, they can become cancerous. And so pro-apoptosis compounds like cannabinoids will basically promote what's called programmed cell death, which is a very important thing. And they've actually shown that targets that cannabinoids hit basically elicit their pro-apoptotic action and then basically reduce tumors. So
Dr. Mark, what you're saying is that if cells don't die the right way, they're basically kind of like White Walkers on Game of Thrones.
They could turn cancerous, Jason. They could turn cancerous. And the other thing that cannabinoids do is they're anti-proliferative. So in order for cancer cells to proliferate, they have to have this proliferative activity through what's called the vascular endothelial cells, which are basically your flesh. Mm-hmm. And so cannabinoids basically stop proliferation of cancer tissues. And those are things that we can test in a petri dish, right? Because we could stimulate cells with growth factors, and then we could look underneath the microscope when we add cannabinoid to that, does it actually inhibit the tumor from growing? So there is a lot of, just to get back to the petri dish thing, there is a lot of value for looking at various models in a petri dish kind of setting, because you're not injecting these compounds into humans. But I think the fact that cannabinoids are so safe and cannabinoids have been used by humans, I know people who have basically had stage 4 diagnosis and people with tumors and just went on a strict FICO kind of, fire all weapons, get as many cannabinoids into your body, and those tumors disappeared. So, anecdotally, yes, cannabinoids can basically attack tumors. I think what Dr. Talleyrand said is absolutely right on. Not all cancers are created equal, and part of it is being able to deliver the medicine to the tumor. If you have a solid tumor, like a glioblastoma tumor inside your brain, well, now you got to get the cannabinoids inside the brain. And getting things across the blood-brain barrier can somewhat be a challenge, especially for polar compounds. But I'll just finish by saying that, I think anecdotally, we know in dogs that have basically tumor growths, if you put, this is the Rick Simpson story, right? Apply cannabis, put as much on as you possibly can, and those tumors could potentially go away. So I think there needs to be more research, and I think we'll find that cannabis and cannabinoids do play a role in treating cancer.
Yes, and I just want to touch. Oh, go ahead, Rico.
I was going to say, somebody once told me that you'd be hard pressed to find doctors that would ever agree to taking chemo treatments themselves. Is that factual?
Well, we're human too, and we also know it's kind of like a mechanic getting their car repaired at an auto shop. They sometimes prefer to do it themselves.
They'll do it at their garage, at their home garage. Fair enough.
Yeah, or sometimes they prefer to go to a specialist. But yeah, definitely, especially if you know what's happening behind the scenes.
I think what cannabinoids can do, and Dr. Talleyrand, please chime in on this, is that like during chemotherapy, when you're just being inundated with these compounds, cannabis can help you eat, cannabis can help you sleep, cannabis can help return your body to homeostasis after you've been assaulted by this litany of very toxic compounds to try to kill these tumors. So maybe cannabinoids can play a role in chemotherapy to reduce nausea, to encourage eating, encourage regular sleep cycles, right, Jean? Because I would assume that just because you're getting cancer treated by chemotherapy, it is just there's a lot of collateral damage there, and maybe the cannabinoids can act to kind of help you back towards homeostasis and deal with that collateral damage.
I mean, it was one of the first things the FDA approved for THC, and so we can prescribe Marinol for nausea and vomiting during cancer chemotherapy.
And
let me just point out too, one study that Professor Meshulam conducted showed that chemotherapy in children, so children get cancer, and when they're treated with chemotherapy, they often it's terrible. You undergo vomiting, and they can't keep any food down. So what Professor Meshulam found is that they could administer THC below the psychoactive dose, so just a few milligrams in an olive oil tincture underneath the tongue, completely blocked all chemotherapy-associated nausea. Now, why they're not using that more prevalent is beyond me.
And just to go back to what we started on, you had mentioned free radicals, and correct me if I'm wrong, but I believe you breathe in around 10 million free radicals with every breath that you take. And free radicals are the same thing that makes cement crack over time. It makes hoses hard and brittle over time. And these are things that are always constantly fighting against you. And that's why it's important to live a healthy lifestyle.
That's probably worse in LA than it is in Vermont.
I could believe in that. I could. That's fair. You know what I mean? That's fair.
Yeah, that's why free radicals are nature's very own Antifa.
Oh boy. And on that, we're gonna go to a commercial. We're gonna be right back.